47-year-old man presents with a history of a frequent, unpleasant crawling sensation in both of his legs, accompanied by an urge to move his legs for the last 6 months. He continuously moves his legs to provide him with partial relief from the unpleasant feelings. The symptoms are especially severe during the night or while lying down in bed after returning from work. These symptoms occur 3 to 5 days per week. He also complains of significant daytime fatigue and sleep disturbances on most days of the week. He is advised to take a polysomnography test, which reveals periodic limb movements during his sleep. Which of the following conditions is most associated with secondary restless diagnosis over here? The rest of the question stem not really that important. Maybe you can take into consideration significant daytime fatigue, but that could attribute to the fact that the patient has not been sleeping very well at night, not necessarily iron deficiency anemia, but that is the answer. Okay, so I already told you secondary restless leg syndrome. So for questions like this, even if okay, so let's just take this one. Okay, so secondary restless leg syndrome has quite a few causes. Okay, I'll just tell a few so you can just know for like namesake. Okay, I would like to divide it as system wise, so it's easier to remember rather than just go ahead and list all of them, because honestly even I wouldn't remember them. So let's say we take hematology. Okay, so just remember 3 important causes. One is already there in the answer, so that's iron deficiency anemia. The other 2 are pretty obvious: folate and vitamin B12. So these 3 are kind of the most common things in hematology, so it's likely that you will remember them. Okay, next we move on to say metabolism. Okay, diabetes mellitus is one of the causes, and the other causes I kind of correlate them with diabetes for me to remember. So the other causes are like renal failure, peripheral neuropathy, and these kind of things are also because of diabetes. So this is one way I remember it, but they are separate causes. Okay, then we come on to, you have magnesium deficiency that can result in this. Even pregnancy can cause secondary restless leg syndrome. And I think the last one, okay, I don't actually remember it very well, but just remember a few causes. Okay, so that's what I'm trying to get at. It's not required or necessary for you to sit and learn each and every cause for this if you're sure of what doesn't come under that. I hope what I'm saying makes sense. So you don't have to know, say, 10 causes of one thing, but if I give you 5 options, you need to know out of those 5 options, 4 of them don't come under this. It's not necessary for you to know that one answer comes under this. Just know that the other 4 don't. So it's more of an elimination strategy for questions like this if you're not sure of it, because I feel where a lot of courses are given for things, even honestly I did not take the time, or nor did I have the power to actually remember all of them. I just knew what didn't come under, and that helped me answer the question. So we look at pulmonary tuberculosis, absolutely no correlation to this, rule it out. Zinc deficiency, okay, so when it comes to like nutrition and vitamin mineral deficiencies, you do need to know the findings of each and every one of them, because they are pretty specific. And in any question stem, if you're able to pick up on those certain words, it will become very easy for you to diagnose it, especially those biochemistry questions regarding the nutrition thing. So it just makes it easier for you. So zinc deficiency, they will most likely only talk about acrodermatitis enteropathica. I've not come across anything else relating to this where they've not mentioned that. If it's not that, they would definitely mention poor wound healing. So these 2 are kind of like the specific things for zinc deficiency. They'll not mention anything else. Vitamin B3 deficiency, just remember the 3 Ds. You have your diarrhea, dermatitis, and your dementia. You don't see any of that over here, so you can just rule it out. Liver failure, once again, does not cause. I mentioned renal failure comes under one of the causes, but it's not liver failure. The only thing I can think of is like abnormal movement in liver failures, liver failure resulting in hepatic encephalopathy resulting in asterixis. That's the only other like abnormal movement I can think of, but it obviously doesn't come under this, so you can just very clearly rule that out as well. Yeah, asterixis.
Thanks for watching. Please give a thumbs up and subscribe for more.